Hello friends and welcome back to my channel Medicine Got Easy with Dr. Mrinalini. Hope you all had good holidays till now and had a good year. So we all are set up for a new year and new year resolution. So now what I want to share here is that till now I had recorded various YouTube shorts, medical as well as some for everyone. Now I want to record a proper video also for the same because YouTube shorts give you a quick review over the medicine. These videos will also not be bigger or a larger one. I will try to break it as simple as I can, and it is hope it will be helpful for all the medicos, especially the beginners and the medical students. You know what is the most important thing as a doctor? If you are going to practice, what is most important thing? How you are going to practice? It's not just knowing the disease and giving the medicine, isn't it? It's very important to elicit, to know what the patient is suffering from. So, from where do we get that? It is very simple, case taking. It is like a good case taken is more than a half battle won, right? So, we are going to first start with the case taking and symptomatology. A well taken case in 90% cases give you the diagnosis itself. You don't need to go for investigation. This is just for confirmations, right? So let's see what are its component. We all have been told that case taking is an art. Why an art? Because it's a skill how you take out the complaints from the patient. So there are few important things which we need to take care of. First and foremost, you should know your patient. Knowing your patient is its biodata. Now, what the biodata includes: name, age, sex, marital status, occupation, address, and nonetheless the religion. Now, why all this? Name is for identification, age, there are certain age related diseases. Sex, we all know different sexes have certain different tendencies to get infected or get diseases. Then the marital status and the religion, because the various religions have various practice and certain diseases are restricted to those community or religion there, right? And as far as the marital status is concerned, now little upgrade has to be done there. We need to ask even the normal people who are in their reproductive age whether married or not, if they are sexually active or no, because these things have changed over past few decades, isn't it? So we cannot miss on that too. Next, again what is an occupation? There we all have read about occupational hazard, and it is here that we are going to apply. We need to know what your patient occupation is. If the patient is going to is working in an IT company, you know, there will be a big belly, there will be tendency to obesity, they are tend to have a sedentary lifestyle, right? So they will be having those complaints there. Just I'm giving example, suppose sitting all the day on the system like this, you are going to have this spondylitis complaint. Sitting all the night, you are going to have an upset tummy because you're not having time for yourself, right? For patient, I'm telling me. So these one example of occupational hazard here, and another one is like in the field workers or in the mines who are exposed to smoke and dust, or the worker who are suppose house helps, they are continuing doing work in water, they are having those, here fungal infection growths or eczema type conditions, right? So we all need to know our patient's occupation. Then age related, children have different tendency, young people have different tendency, old people have different tendencies, and so is the disease course of disease changes from person to person. So we need to have a proper case taking, and with proper biodata, you can imagine how important is the biodata, you cannot miss on it. Then comes complaints of present illness, right? When now you got to record why the patient has come to you, that is the presenting complaint, right? Why the patient has come to you. Patient has come to you with his complaints, the complaint which has driven the patient to you, that is presenting complaint. Now that not, oh doctor, I'm having headache. Okay, just headache will not do. Why headache? How headache? How it started? Since when you are having? Did you have any other episodes of the same headache, or do you get this headache often? How often do you get it? in a family if anybody had. So again, proper detailing, onset, duration, repetitions, causation if you can make out. It will help you complete the case and get to easier diagnosis. Then present complaints done with details. Next is past illnesses. If the patient had similar complaints or any childhood diseases like asthma or diabetes, or in a family if they have some disease which has is running in the family, and more you cannot skip one part is the injuries. Many people it goes unnoticed. We need to take note of any past injuries or accident in a patient as well. And after having a record of the past illnesses of the patient, now comes your personal history. Like personal history, how is the appetite of the patient, how is his thirst, are the bowels regular, is having any urinary complaints or no, then how is the sleep, is it disturbed often, or they are having a sound sleep, they're sleeping less or more. Had there been any weight loss noticed in the patient, or if they are having any habit, like not only tobacco, tea, for tea habit is also there, tobacco, alcohol, smoking, they are at the top list. And in fact now, that is my experience or whatever I'm listening or gathering knowledge, we need to know how much is the sweet intake of a patient as well. Few examples to go through for, like heavy smoking in youngsters may really, lead to early hypertensions, chronic cough, liver disease like having that alcoholic hepatitis, hepatomegaly, whatever. I mean, all those complaints they come up with a lifestyle. Too much tea leading to ulcer and heartburn. You're having very spicy food, all the rich food all the time. Come on, you're torturing your gut, man. So any person coming with certain complaints, you not have to take note of those complaints and their dietary, sorry, overall habits, right from their appetite to their living style. And one of the very important factor which I mentioned in the past illness as well is the familial conditions. Like we we know most of the people, they do have hypertension in their family, diabetes in their family, but you got to record more. Like you need to poke more in the patient case, like if there is asthma or skin complaints, joint complaints, or even that genetic disorders like chromosome related problems, like X-linked recessive disorders. So this X-linked recessive disorders, their women are carrier, not the person who shows you the disease. Similarly, autosomal dominant disorders, autosomal recessive disorders, and yes, most important, like here the community plays the role, or the religion, where you need to have the history of consanguineous marriage, that is marriage between cousins or brother and sister in the far off relationships, because various religion, various communities, they have a various practice. So there in these conditions, autosomal recessive disorders are very common. And to be very specific now about sex, you should not miss a woman's menstrual history, whether she is menopausal, postmenopausal, or a girl before puberty. You cannot miss the gynec history. The girl before puberty, the first onset, if it is getting delayed or something, that is, I mean, not the menstrual history as such there. So if the puberty is being delayed, like, or after the active phase, how are the menses, and after even the postmenopausal phase, how were the periods. Most of the women we find these days, they have been operated for their uterus, hysterectomy has been done. So we need to take note of all these things again. I hope this conclude our part of case taking, and I've tried to make it as easy as I could, and tried to be precise. Hope it helps. Take care. Bye bye.